Good afternoon, and welcome to Advanced Directives, the Patient Voice, at HIMSS Interoperability Showcase 2022. I'm Dr. Matthew Rose, the clinical lead on this scenario, and I'm pretty excited to bring to you today a pretty incredible program that we've put together with the collaboration of 6 companies under the auspices of BPM Plus Health. So what we have here is Red Hat, HealthFlow, BPM Plus Health, Cerner, Interoperability Institute, Trisotech, and ADVault, all collaborating together to bring advanced directives to the the emergency room within 30 seconds of the patient arriving. Just a quick poll before we get started. How many people in the audience have an advanced directive? Brilliant. How many people have parents that have an advanced directive? So if you look around the room, not a lot of hands went up for either of those questions. Okay, only about 33% of individuals actually have an advanced directive at the moment, and usually it's at home. So if we were to end up at the emergency room in Orlando here today, how many actually think that the emergency room physicians and providers would actually be able to have an advanced directive in hand? Most people are putting their hands down here, right? We don't think they would because it's in the filing cabinet someplace else. So what we're going to do today is actually explain how we're going to bring that together for you. And if we flip the slide here, so through this collaboration last year, we brought a group of multi-stakeholders together. Doctors, nurses, administrators, vendors, technologists, all collaborating to create a standard process using the BPMN model on Trisotech's platform. And what you see up top here is the nurse's evaluation of how they use advanced directives, and then on bottom, the clinical providers. On the back end of this is some automation and technology that happens to make all of this operate in the proper direction. So I'm going to hand over to my colleague, Ken Allgood, who's going to introduce BPM Plus Health and some of the processes to you.
Thanks, Matt. So BPM Plus is a consortium, as Matt said, that focuses on building standards-based information models and automation models that we can then take and move those business process models from location to location, system to system. We work together to enable use cases like this, best practices to be able to be adopted and accelerate that adoption within health systems, leapfrogging really, over that 9-year adoption cycle which currently haunts healthcare in general. This process, as we see here, it covers the entirety of the nurse evaluation. We've pulled out specific parts, and we'll be covering those in today's use case. So if we want to move on. And for those that aren't familiar with BPMN, it is a graphical notation for specifying the business process. What that means in real life is that clinicians, doctors, nurses, and other care providers in the case of healthcare can actually engage in the development of the process flows that really represent how they do work. This helps inform systems and better support the delivery of care for our patients. And more importantly, we're able to tie in actual health data into this business process flow. So standards-based, in the context of this delivery, standards-based health data will actually be exchanged to be able to support the process you're about to see. In this particular architecture, we're reflecting the different companies and their products that have come together to make this happen. Most importantly, how are we supporting this? How are we actually driving this? At the bottom, we've got ADVault. That is where all of the advanced directives are stored for our patient. That's where it's all going to come from. Everything about how he wants to be cared for, it's stored there. We're going to bring it in at the right time in the right place. We also have from Meld, which is acting as our external EHR. We've got his history. We've got Emmanuel's background, which is going to help to inform the ER delivery of care as he arrives. Up here on the right-hand side, we also have Cerner. Cerner is acting as the ER EHR. So that's the system that the ER docs and nurses are actually going to leverage to be able to care for him. Over on the left-hand side, inside of a Red Hat OpenShift container, we've got HealthFlow, we've got Trisotech, which is providing all of the automation, again, covering that same business process, that BPM process that we talked about earlier. We've also got other Red Hat technologies that are helping to conform the data And HealthFlow is providing that patient and his family with a user interface to access not only the data, but to also approve the handing off and sharing of that data as we move forward in our process. And Simon, if you want to go ahead and flip to the next, well actually no, we're going to, if we want to provide some more information about Red Hat and their OpenShift container. Satish?
Good afternoon, everyone. My name is Satish Shirinki. I work for Red Hat. Red Hat's OpenShift container platform is the market leader in the container technology. In this demonstration, we are hosting products from multiple vendors on the platform that can scale the solution globally. OpenShift is an enterprise-grade platform. In addition to managing containers using Kubernetes technology, it provides several enterprise capabilities: security, alerts, monitoring, tracing, logging, among many others. The platform also provides key technologies to build and deploy cloud-native and container-native applications using our serverless and service mesh. In addition, Red Hat provided the key integration technology to transform and move data between the systems that you see here. All of these technologies can be hosted on multiple clouds, may it be AWS or Azure or Google Cloud Platform and many other platforms, as well as within on-prem data centers. Back to you, Ken.
Oh, thanks, Satish. So, Simon, we're now going to introduce Emmanuel. And from ADVault, we're going to have Maria walk through Emmanuel, his history, but also talk to what is involved in bringing his advanced directives to life. Thank you.
Thank you, Ken. I'm Maria Moen with ADVault, the Senior VP of Innovation and External Affairs. Let's learn a little bit about Emmanuel. Emmanuel is a proud gentleman who doesn't want to burden his children with his health issues. He is 76 years old. He has enjoyed a relatively healthy life, and he moved from Ohio to Michigan to be closer to his daughter, Katrina. He is now living in an independent living facility in Michigan, and that particular community has a wellness center that is staffed with practitioners who help to ease the health and the wellness of the residents who reside there. Go ahead. Emmanuel's community-based primary care physician invites him to complete his advanced directive, advanced care plan prior to his annual wellness visit that is coming up shortly. And in doing so, he uses his My Directives for Clinicians app, and you can see an image of the email that is PCPQs that invites Emmanuel to create his advanced care plan. Emmanuel responds to the email and logs onto mydirectives.com and is able to specify those things that are important to him, such as, what are your advanced care goals? What is important to you? And sitting down with Katrina, they began to work on his advanced care plan and his advanced directives. Now, they use the consumer-facing app, and Emmanuel designates Katrina as his durable medical power of attorney, healthcare agent. It all means the same thing. And then secondarily, he grants access to Katrina to view his documents. And you can see on this screen how those two actions are not synonymous with each other. He may want to designate Katrina and then have a conversation with her prior to actually releasing the documents to her. So Emmanuel goes into the wellness center at the community. He has a discussion with his primary care physician, and his primary care physician is actually able to surface all of Emmanuel's documents and have a discussion with him about the risks and benefits of the decisions that he has documented. When this kind of consultation is done in conjunction with an annual wellness visit, it is covered 100% by Medicare. There are no copays, and both of those events can occur on the same day. Here you can see where Emmanuel's PCP is able to see all of his documents and really engage in that discussion. And what's interesting to note is he can actually see the scanned, uploaded state advanced directive that Emmanuel and Katrina have prepared, as well as the advanced care plan that they have prepared together.
Thank you, Maria. Perfect. So now let's fast forward 6 months. Emmanuel is living in Michigan. He's in an independent living facility, and he is starting to feel unwell. He develops a mild fever, a slight cough, but he's also losing the sense of taste. We all know kind of where this is leading. He goes to his primary care physician that the community center provides for him, and he diagnoses positive for COVID-19. Because he's a mild case, instead of sending him to the emergency room or the hospital, they send him home with advice to isolate. They then tell him they're going to send him a care package in the mail. It should be received within a few days, and that's going to provide him with a blood pressure cuff, a pulse oximeter, and a thermometer. That's all going to be connected to his phone through the HealthFlow app and provide them with information. They're also going to have a telephone call with him once every day just to make sure that everything's going okay. So on day 4, he receives that package. Unfortunately, it's been a few days and the mail got delayed and things had happened, but fortunately he was okay. He relatively the same and stable throughout those several days. On day 5 and 6, he starts to worsen. And remember, he went there to see his daughter, so he's having daily telephone calls with his daughter and video conferences. So he's putting up a brave face for her, letting her know nothing's wrong, everything's perfectly fine. Day 5 and 6, as mentioned, he's a little bit worse. He develops a higher grade fever, cough, and a chest pain that's actually getting a little bit worse. Day 7, suddenly drastic decline. He can't get up out of bed. He's lethargic. He's really having trouble breathing. I mean, he's so short of breath. And he decides, I can't hide and put on a brave face anymore. I need to call my daughter. So he calls Katrina and he tells her what's going on. She says, Dad, you have to go to the hospital. I'm calling 911. So they hang up. She calls 911 and emergency services is on their way. So emergency services arrives and they realize this is a critical case. I mean, his oxygen saturation rate is really low. They put on an oxygen with a non-rebreather mask, try and get his saturation rate up, but they're not successful. They get him onto the emergency vehicle and they start heading towards the hospital. As emergency services do on the way in transit, they notify the local emergency room what's on way and they radio in. We're transporting a 76-year-old man diagnosed with COVID-19. He's in critical condition and unstable, rapidly declining. He has a pulse rate or a heart rate of 120, a respiratory rate of 36, an oxygen saturation rate of 83% on a non-rebreather, GCS score of 12. Obviously, very critical. He needs support. So in preparation for that support, the emergency room administration and the secretary starts putting his name into the computer system to try and pull up any records they have. As you can see here, there's no records in there other than the name that she typed in. He just moved from Ohio to Michigan, so nothing's going to be in there, and the regional HIE has no information on him either. So ultimately, we're stuck here in a typical situation where he's entering in unstable, unable to communicate for himself into the emergency room. So what would happen? They would have to find a way to reach out to his family member, find out what his wishes were, okay? Or if he is able to communicate for himself, there's a whole standard process of obtaining what the patient's preferences are, having a short consultation with the patient, documenting it on the hospital-approved protocol paper, and then uploading those documents into the system in order to ensure that his wishes are met and that it's recorded. That all creates a lot of energy, time, and resources for the ED staff that they need to be using to help other patients. So, and what you're going to see in this process, in this flow that we've put together today for you, is as soon as they identify him as a new patient, immediately that triggers a flow so that the patient's family proxy and family member who's part of their care team can consent to the initiative. And then from the consent, once that happens, all the information is in the emergency room EHR system within 30 seconds of his arrival. So I'm going to hand over to my colleague Ken here, who's going to talk a little bit about the next stages.
Thanks, Matt. So as Matt just said, individual's on the way. However, he doesn't have a record in the hospital right now. That sends off an actual message, a secure message that goes to his provider, who's a subscriber to the hospital. He receives notification, and that triggers the entire automation process that is going to aggregate that data we talked about earlier, along with all of the advanced directives. And to describe that will be Simon.
Hi, my name is Simon. I'm with Trisotech. At Trisotech, we do modeling and automation of BPM plus models, and today, behind me, you're going to see the interoperability process that we're going to automate. So at the top we have Cerner, as we mentioned, is the system of record for the emergency room. We're going to have in the middle HealthFlow, who's going to be getting data from both ADVault and MELD and packaging that and making it available at the ER for Cerner. So while we were going to present on this side the interaction with the different users, on this side we will be able to follow the process through a simple animation that I will move on. So I'm going to start the animation. The patient is still in transit to the ER, and back to you.
Thank you, Simon. So the minute that registration starts, Cerner is going to send out that secure message we talked about. It includes his name, his birth date, as well as an MRN. It also includes specific criteria that we're going to use to be able to pull together his information. HealthFlow is acting in the proxy for the healthcare provider here to listen for these messages, and then that generates this set of activities here. So HealthFlow is going to reach out to the ADVault. We're going to pull the the advanced directive information from ADVault. We're also going to pull from the external EHR, MELD, all of the history data that's applicable to this particular use case. And so there's sets of rules as to how much data we're going to pull. We're going to pull the right set for that. We're going to compile that along with the EHR information, the AD information. We're also going to compile the PHR information, the locally stored information from the HealthFlow app that Emmanuel's been recording as he's been waiting at home hoping to feel better. We're going to compile that. We're going to package it as a FHIR bundle, and we're going to push that to the patient's app. So in this case, this information goes to the patient's care, the patient's family. They are his care team. They get to review exactly what's been requested and take a look at, we've got the DNR here, the do not resuscitate. We've also got additional documentation from an advanced directive standpoint. We've got up here the recipient, who's actually making the request, and we also have a picture, a bit of a snapshot of the health data that we're going to be pushing over as well. His daughter's going to consent to share that data. She's walked through this process with him anyway to develop this documentation. She's going to press share. She's going to get a message back that the information has been received. Recipient's Michigan General. We also have in there a time window. How long will that information be accessible? So in case the hospital needs additional historic information, we already have consent to be able to continue to share that to support his care. And now if he had shown up in the emergency room and he was conscious, if Emmanuel had come in on his own, he could have walked through this entire process as well and shared that information simply by having them scan the QR code on the HealthFlow app. And now we'll take a look at the information as it's existing now inside of the Cerner EHR. Jeff.
Thanks, Ken. My name is Jeff McRobert from Cerner. Here we can see our patient Emmanuel Jones has presented in the Cerner Emergency Department. From our FirstNet Emergency Department tracking board, we can see that Emmanuel has been assigned to bed 1A. From this quick view, a provider can look at Emmanuel's chart and find outside vitals that were written via FHIR on Emmanuel. Also directly within the Emergency Department workflow in pages, using an open and interoperable EMR, we can see outside advanced directives written to Cerner from HealthFlow. So within the workflow, the provider can open that advanced directive, click View Document, and that provider can scroll through this document to see the full power of attorney and advanced directive. From within this document, the provider can also see Emmanuel's care wishes around how he would like to receive treatment in the case of an emergency. So here, because this document was within the Cerner workflow using interoperable standards, our providers are able to take care of Emmanuel how he wishes to be treated.
Perfect. Thank you, Jeff. So what you see here is within 30 seconds of the patient arriving in the emergency room, the right information is available at the right time. And so, as I mentioned before, in a non-standard situation, or in a typical situation, where the patient is arriving and this isn't available, the patient's going to get the best clinical treatment possible, and that tends to be, or in many cases I should say, ended up with the patient being intubated. But in this particular case, because we understand he doesn't want any invasive intubation or any invasive treatment, he's not going to get this, and he's going to get that. And as a provider, I can put him on a full bag mask. I should say a full mask with ventilation, not a bag mask, but a full mask with ventilation there, and ultimately try and get that saturation up as much as we can. Okay, so with that in place, we're able to stabilize Emmanuel, at least in the emergency room, and get him ready to transport to the ICU. His daughter arrives at the emergency room. It took her 30 minutes to drive in from home. Fortunately, she was able to get here. And when she arrives, she's thinking the entire time, really worried, what's going to happen to my father when he arrives? We had this discussion around advanced care planning, and we know he doesn't want to be intubated. It's the last thing he would ever want. But what she was relieved to find, even though she's worried about her father still, she was relieved to find out that he was on a full face mask rather than actually being intubated. And she was able to be there, hold his hand at the side while she was protected, and escort him and with the clinical staff to the ICU. So what we ended up happening is, and what you saw here, was 6 companies collaborating across through an umbrella called BPM Plus Health, right? And bringing a unique solution that delivers the advanced care plan at the right time, at the right place, to deliver the appropriate amount of care. All in all, saving the ED time, resources, and money while giving the best quality of care possible. Thank you for joining us today. That's Advanced Directives, the patient's voice, at the Interoperability Showcase 2022. Thanks.